You're the right person to be here.
So are y'all seeing my slides scrolling through or no?
Yeah.
Okay, perfect.
You're good.
Good morning, everyone. We'll give people just a minute or two. We'll give our lovely colleagues some time to admit people from the waiting room. So we'll get started just in a minute here. All right, well, I think we'll go ahead and get started. Good morning, good afternoon. Well, I think we're still mostly morning. East Coasters, good lunchtime to y'all. We're thrilled to have y'all join us today for the next of our webinar series, which is today focusing on our ELNEC graduate curriculum, specifically Module 4, which features our symptom management content. The ELNEC graduate curriculum is designed for any advanced level student, so those who are preparing for APRN roles and those who are preparing for graduate roles. There is quite a bit of content that does support APRNs in their practice, but not an APRN specialized course. We have a whole different curricula for APRNs related to specialty palliative care and palliative care in general. But today we're going to focus on symptom management. I'm Megan Lippe. I'm one of the co-investigators for ELNEC. And I am at the University of Texas Health Science Center in San Antonio. I'll let my colleagues here introduce themselves. Andrew, you want to introduce yourself?
Sure. My name is Andra. It's nice to see everybody here today, and I'm at University of Portland.
And Andrew and I do, we work together very closely to support schools of nursing with their palliative care education. So you probably maybe have interacted with one or both of us, but any school of nursing related curricular question, please know we're here to support y'all. And then we're joined today by two guests who are true experts in the field, Pat Coyne, who's here, and Connie Dahlin, who's here. Connie had to step away for just a moment, but she'll be back with us. Pat, do you want to introduce yourself, Connie?
Sure. I'm Pat Coyne. I'm at the Medical University of South Carolina and I've been here for about 8 years. I just actually recently retired as director, but I'm still seeing patients.
And Connie.
Hi, everyone. I'm Connie Dahlin, and I'm a palliative nurse practitioner by training, also an oncology clinical nurse specialist. And I still practice at a safety net hospital and do education and some other national projects on community-based palliative care and education training. So happy to be here today.
Thank you. So for those of you who've joined us before, this is very much structured like many of our webinars, but for those of you who are joining us for the first time, we'll spend the first few minutes of our time together providing an overview of ELNEC and also our ELNEC graduate program. And then we will actually take y'all to the module. We'll show a small piece of our symptom management module just so that you can get a taste of what that looks like for your students. Especially for those of you who maybe aren't familiar with the curriculum or aren't using it yet in your programs. And then we will open the floor for a while with our experts, Pat and Connie, who are going to share some observations they have about graduate education related to symptom management. And that's where if y'all have questions related to teaching symptom management to your graduate students, that's when we'll provide an opportunity for y'all to sort of pick their brains, so to speak. And then we'll conclude with a little bit of some kind of group discussion about some strategies we can use for graduate education with symptom management. All right, so just to provide a little bit of a grounding on where some of this work is coming from, in 2017, the American Nurses Association and the Hospice and Palliative Nurses Association issued a joint statement, which was a call for action where nurses and lead and transform palliative care. This was a an important document that sort of said, why do all nurses need to be trained in palliative care? And the very first recommendation that came forth in that statement was that schools should adopt the ELNEC curricula as a standard for education. At the time of this publication, we didn't yet have ELNEC graduate, so it's not listed there, but it's not because ELNEC graduate isn't as great as our other curricula. It just hadn't been, it was in development at that time, but that we kind of extrapolate that they would also support ELNEC graduate for graduate education, but that using these ELNEC curricula is really a good way to provide the knowledge or the didactic content for palliative care for our students. So for those of you who maybe are not familiar with ELNEC, which is the End of Life Nursing Education Consortium, it was developed in 2000. So we are in year 23 of ELNEC's journey. And over time, there have been many different curricula that have been developed. It started with ELNEC Core, the first course that was offered in 2001. And then the most recent one is the one we're featuring today, which is our ELNEC graduate curricula. We do also have a curricula for undergraduate and new graduates, which would be more nurse residents. And those are our other webinars that we feature. So many of y'all might have found your way to us just because of the new essentials, which has named has really kind of shifted to competency-based education. The ELNEC graduate resources that we provide really feature how we can prepare students at that level 2, that advanced level student in terms of palliative care. And then specifically, the resources that we offer to support schools of nursing have to do with hospice palliative care sphere. And then want to just briefly also mention a resource that we think is really helpful for schools to know about, especially as you might be in a world of competency-based education right now, trying to think that backwards design. How do you measure student competence in these areas? There are some helpful resources for you. There are graduate competence statements that our team were originally developed in 2019. And then with the release of the new essentials, we've actually updated those in 2022, specifically to align the competency statements with the concepts and a lot of the important elements of the new essentials. So those of you who might have been familiar with GCARES, originally it was structured with 8 competence statements for all students, whether they were masters or GMP. And then there were 5 additional statements for those in direct care. So not necessarily for those maybe in a leadership program or a nurse education program, but those who were more training for APRN roles. With the new essentials, which we no longer have sort of that differentiation between masters and DMP and the different types of programs, since they aligned and brought all of those together for advanced level, we mirrored that with our structuring of GCARES. So now there are 12 competency statements that are specifically written to capture what we would expect of competence in palliative care for advanced level students, with the caveat that then schools of nursing can adapt to what that looks like for their specific graduate program. And we wanted just to spend a few moments letting y'all know which of those GCARE statements really sort of map to or align with this symptom management module. So the third GCARE statement focuses on dynamic changes in demographics, socioeconomic factors, the healthcare system, emerging technologies, but all with the focus to improve outcomes for persons with serious illness. And with symptom management, we do try to think about holistic approaches to managing symptoms for patients. We have resources on our ELNEC faculty corner, which we'll show at the very end, where Andra and I and some of our colleagues have actually mapped all of our CARES and GCARE statements to all of the domains and competencies and subcompetencies and concepts from the essentials. So we've done that crosswalking for schools, but as you can see here, all 10 domains have some subcompetency that align with this GCARE statement. And you can go to the other documents for more details. GCARES 8 focuses on holistic assessment and management of pain and symptoms that are common in serious illness at the full scope of practice for that individual. So this is again where schools could tailor what that would look like to their specific type of graduate program. The 9th GCARES statement talks about coordinating culturally sensitive, patient-centered and family-focused palliative care across settings. And so while we focus on symptom management, we do want to think about that continuum of care for patients living with these serious illnesses and needing symptom management. And the last one is GCARES 10, at least that really strongly aligns with this. This module is consulting with specialty services for complex palliative care. Our graduate curriculum is still tailored more to a generalist level, even for APRNs. This is for a generalist approach to palliative care, but we want to ensure that that they're seeking consultation from specialists in palliative care for those complex situations. So with that, also just want to share, so we've done a few webinars already to capture our first 3 modules of ELNEC graduate. Those were recorded and have been posted on our ELNEC faculty corner. So you're welcome to go back and watch those if you weren't able to join us live for those sessions. The slide decks for those are also made available. And we alternate months with our ELNEC undergraduate. But as we look forward to the next couple months in December, we'll be featuring our final hours module, which is module 5 of ELNEC graduate. That encompasses loss, grief, and bereavement. And we're going to be joined that month by Susan Meskis, who does a lot with really exciting aesthetic learning. And then in February of next year, our plan is to round out our series, and the 6th module of ELNEC graduate focuses on leadership. So we'll finish our series with that in February. So just be on the lookout. The December date has already been posted. You can register now. We need to wait and see for Andrew and I what our teaching schedules look like before we post for spring sessions. Our most current recent statistics, we have over 1,136 schools of nursing that have accessed our curricula for the undergraduate, and our graduate continues to grow. We now have 389 schools that for their graduate programs have accessed ELNEC graduate. So if you are using it, you are in good company. And if you're not, that's okay. We'll talk about how you can check it out more to see if it might be something you want to include within your curriculum. All right, so we're going to, and by the way, if you have questions throughout this, please feel free to put things in the chat. I'm not able to see the chat at the moment. So Andrew, if you will just kind of let me know if something comes up. Thank you so much. One of the things we've learned over time as we've done this is that some people, before we start talking about how to use it, they want to know, well, what are we talking about? What is this graduate module you're talking about? So we want to show you a little bit of what this looks like. The module objectives for our ELNEC graduate, this module is applying the biopsychosocial spiritual module of pain assessment and management. We really focused on common symptoms in serious illness. We try to present a robust presentation of pharmacologic and non-pharmacologic strategies that nurses can use to manage those common symptoms. And then there's again that aligning with the GCARES statement, referring patients with complex symptoms to specialty palliative care, or to interdisciplinary team members. So with that, I'm going to share my screen, stop sharing for just a second so I can make sure I'm pulling up the right module to show ELNEC graduate. We seeing ELNEC graduate? Yeah, okay. So I haven't started this at the very beginning, but this is the current layout of our ELNEC graduate. Those of y'all who might be using both, the ELNEC undergraduate was just revised, so it has a little bit of a different look. ELNEC graduate, your students will continue to have access to this version for at least another year, if not more, as our revisions are forthcoming on ELNEC graduate. But as you can see, the way that this is structured, our modules are built so that students have to complete the elements within a given section before they're able to progress. So they can't just click through and be done. They do have to interact and actually look at all of our content. This is featured where we do try to use a lot of images that match the contents that kind of reflect what we're trying to capture. In our symptom management module, we do integrate quite a few different case studies. So for example, as we're about to look into fatigue, they present a patient that might be a way to help ground the student in thinking about this common symptom. As students progress through, there are some slides that, again, just sort of provide you some information or build on the case, and they ask you the questions. As they move forward, a lot of times then it's presenting the information about fatigue. And this is very updated with most current evidence-based practice, which is what we perceive as one of the benefits of our ELNEC curricula, is that they are updated very frequently, whereas textbooks might be a little bit more outdated. And we do try to make sure that these are as reflective of best practice and current practice as possible. So again, as students continue to move through the different modules, there's, again, more information that presents. There's statistics that it present at times. And again, trying to keep it dynamic in some ways, but also not where students have to do a lot of different clicks throughout. So I'm going to keep moving here, but like there are some stages, and I already accessed all of this, but where a student would have to, these numbers here would all be green, and the student would have to click on each one and read what's there before it would actually open up the next button for them to progress. So because I've already done all that, my next button shows. But if, for example, a student had only clicked 5 of those, a message would pop up that says you need to complete all components of this before you can progress. So we'll keep moving forward because I want to just share. So with all of our symptoms, again, we try to present the pharmacologic and the non-pharmacological interventions that they might consider in their practice. And then, so again, here's the non-pharmacologic. And then we, in this part of it, it rounds out with sort of kind of the answers. Not that there's ever one perfect answer, but just some, now that you know this, what might be some approaches or some ways that you can respond to the first question presented in the case study. We also do have at times videos threaded throughout our modules with our experts from the field. So we're not going to show the video, but for respiratory symptoms, you get to hear from Pat Coyne, who's joined us today. So there are videos as well where that allow students to hear from the experts in the field and present some really interesting perspectives, some ways to engage students with other ways of learning as well. So that is, I'm not going to go through the whole module, but I just wanted to orient everyone to what this looks like. Our modules are also developed so that there are times knowledge checks throughout, whether it's in the form of case studies or questions. At the end of every module, the learner does have to complete a knowledge assessment, which is multiple choice questions. They have to pass that with an 80% in order to be deemed, that they've met the knowledge expectation for the module. If they don't meet the 80, they have to start over again. We have more questions in our test bank than they see on that knowledge assessment. So if they don't make the 80 and they have to take it again, they're going to see different questions. So it's really important that they are engaged and they are paying attention to the content, because they can't just try to memorize the answers and then take it again. That's not how it works. They do need to know the content. Once they achieve the 80%, they get a certificate of completion. So a lot of programs will have their students then upload or submit that certificate as maybe a ticket to class or some way to provide evidence to their faculty that they did complete the assignment. One of the words of caution we encourage faculty to consider is that once the 80% is achieved, students cannot access the knowledge test again. So they couldn't try to earn 100%. So we really caution against assigning a numerical grade that matches what they earn on that assessment test, because they can't achieve 100 if they got like a 90. So instead, maybe think of it more as a complete, incomplete. And then what we're going to talk about here in a little bit is then, great, if you have your students do this as a way to provide the didactic content, what are your opportunities to then in the classroom help students think about the application of this, or to maybe tailor what they learned to what the role is that they're training for. So if they're in a leadership program, what might they take from this that can inform their practice, versus if they're in an APRN program, what can they take and then utilize in their practice from this? So that's where we're going to go next. I'm going to close this. I think I should still be showing my slides. Yes, maybe. Perfect. So we are now at our Q&A session. So I'm going to stop talking. I'm actually going to stop sharing the screen too, just so we can all see one another. But this is where we welcome y'all to ask your questions. Either you can type in the chat, or if you want to raise your hand and we can call on you. So you can ask your questions of Pat and Connie. And while y'all are thinking of those, we're going to open the floor first for Connie and Pat to share some of their observations or reflections on this.
I was just going to say that, I think one of the things about thinking of this in your graduate program is, you are preparing the next generation of APRNs. And I think no matter what their specialty is, whether they're doing primary or acute care, whether they're doing, adult gero or pediatrics family or gender or psychiatric, or this is a quiz, what the last one is. Anyway, the sixth one, they're going to have individuals with serious illness. And so really thinking about that, of whether going into their practice as APRNs, not only identifying that people will have comorbid conditions that are chronic and sort of trying to think about what they're doing, but sort of thinking also about if they have a serious illness, how do we start some of that care upstream, understanding that it will look different for cardiac patients versus a new cancer diagnosis versus somebody with ALS versus somebody who has comorbid diseases of COPD, kidney failure, type 1 diabetes, which is actually one that people don't really think about. Diabetes is a chronic illness that leads to a lot of other things, right? So there's a lot of pieces about helping them think about their practice as they go forward, that it's not just patients who are dying, that this is really about care that should be integrated. That's really about quality care for all patients. So Pat, I don't know if you have other thoughts or comments.
Really, the thing I would just add to it is, for those that are working as advanced practice nurses, this is something they're going to utilize wherever they land upon graduation, because the skill sets are just required in any population. I get curbside every day about things that, frankly, I wish I had learned in graduate school that we're teaching today, because you need the skill set to manage a lot of the symptoms in the populations they care for.
Any questions from the group?
I have a question. I'd be curious to hear from you all when you think about that curbside that you were just talking about, Pat. Like what are the kind of things as they think about sort of operationalizing this for their students? What are examples of things that you would imagine that a primary palliative care graduate nurse would kind of be able to manage?
Well, I think there's a lot.
Yeah.
No,
Go ahead.
No, I think there's a lot of critical thinking that occurs. In the old days, you'd think about dyspnea and everybody would think morphine or something like that. And, nowadays you really have to think about, could they have CHF? And so am I looking at diuretics? Am I looking at bronchodilators? Is it early fatigue and cancer? Should I be thinking of an exercise program which will prevent fatigue down the road? So really a lot goes in there. So depending on where they are in the course of their disease, what is I'm offering it to help with that? And it could be something as simple as looking at thyroid function for fatigue when everyone else is thinking, sleep hygiene. So I think you really have to take a step back and think through ways to do this. And of course, we see a lot of things that we miss. Like I'm picking up depression all the time where no one else has asked the questions. And so all of this kind of goes into, we know with chronic illnesses, there's a lot that comes with it. And I never see someone with a symptom. They're clusters. And so kind of combing that out and figuring out how you're going to manage it is really interesting. So, I have this case that I always run by the students and I've got a guy with an LVAD who's got pneumonia, new lung cancer, and and has pneumonia and with the new lung cancer. So how am I treating the dyspnea? Is it LVAD failing? Is it needing more diuretics? Is it the new pneumonia that's causing it? Is it the lung cancer and the tumors making it hard to breathe? Could it be hypercalcemia that is causing part of the issues on top of all of this? So everybody wants a quick answer, but I think a palliative care clinician has to be so great in assessment. And I think they need the best assessment skills because it's complicated.
And I guess what I would say to your question, Andra, is that, when we think about primary palliative care, which is what we're teaching them, we're expecting that people will have a working foundation to talk about what Pat is saying of like, okay, it's dyspnea, but we're not just doing opioids or bronchodilator, right? Like we're really thinking, oh, there's 3 different things. And just because they have serious illness, we are not letting go of state-of-the-art care. And so it might be that we're tinkering with that. Or if they're in pain, we expect that people would still have a working knowledge that morphine is helpful, but that there's different types of pain and doing that. So we're expecting them to use some critical thinking skills that any APRN should be able to do. Now, obviously, if you have more complex pain, I had a woman the other day with a 43-year-old with HIV, traumatic background, with a vaginal rectal fistula and kind of falling through. She needed a block before she was waiting a month for surgery, right? And I have a team that also, by the way, she had substance use disorder, right? So like anybody walking in that room was like, oh my God, I can't do this. And it's like, okay, that's not the answer. The answer is I'm going in and recognizing there's some complex pain. Now, we wouldn't necessarily know that they would be comfortable with all of that, but saying, wow, this is a complex patient, just throwing opioids at them is not going to be helpful. How do I bring in, if we have a addictions team, how do I talk to them? How do I help calm down? Remember, I work at a safety net hospital, calm everybody down to say, yes, you haven't seen these medicines before, or you haven't seen these doses, but ethically, we need to manage her pain. And because you're not comfortable with it doesn't mean we don't do anything, right? So sort of helping to be an advocate with those. And I think also helping nurses when, you have somebody in the ICU who comes from say a long-term care part. And one of my things that I hate that I see is the patient failed hospice. And, if you read through the note, which, hopefully we're teaching the APRNs to kind of get their own history, talking to the family to say, tell me what's happened in the last 6 months. What happened with rehab? Did you have conversations when you went there? And then you come to find out that they may have had a goals of care conversation, but it was never documented. They just had forms that signed DNR, DNI, but they were never told about hospice. And oh, by the way, they have a flu, which actually got into pneumonia, which could have been treated even though they had serious illness and avoided an ICU. So like some of that communication part of just asking questions to say, I'm not just going to take this at face value. So I think empowering people to feel like they can take these skills and say, these are complicated patients, and this is really about good care, of asking what's the patient know, how much they want to know, and what really matters to them so that we can tailor that treatment to them.
Yeah, you just kind of what's coming, like a visual that's coming to mind for me is it sounds like you get, at this point, you're pulled in as the specialist and you're sweeping away, trying to get to the pieces that really you're there for, that a primary palliative care kind of perspective should have dealt with before.
Right, like the surgical NP who went in there and just looked at the surgery and said, I'm not going to deal with this. I'm just prepping her. And like, really? Like, you had a whole conversation and this person's telling you she's 12 out of 10 pain and you're just writing ready for surgery, doing whatever, defer. Like, no, I would wish that she would have called me and said, I'm just here for surgery. There's a lot of complex needs going on. I've asked her what's really important, and she wants to have pain control. And oh, by the way, she has a 2-year-old at home that she's worried about because she's in the hospital. And so how do we work with that? Like, I didn't want her to fix it, but if she'd identified some of that and maybe said to the team, this is a really complex patient and our expectations will be different. Right? Like, just that sometimes can help people, because you all know that you have these APRNs who are jumping into new jobs. And as soon as that patient is admitted, guess what everybody's thinking about? Discharge. They don't care about what happens in the middle. So you're wanting your graduates to come out to understand that part of our role is to advocate and say, this is going to take more time, or this is more complicated, and we need to bring in the specialist, whether it's us, it could be the pain service, it could be whatever, but really kind of thinking about what triggers that they need help, and that also it's okay to ask for help, that they don't need to know this.
Yeah, and I think you bring up a good point that, as we mentioned when we looked at the module objectives, is that there's a lot of the content that really tries to say, what can you do in your role as a graduate? Preparing the graduate student for in your role, what are those things that you can do when you're caring for these patients with serious illness? But then also, when do you need to refer? When do you need to reach out to specialty? And really with this idea of, there is a lot that we can empower our students to be thinking about critically and to be doing in their practice to maximize quality of life for patients before they just jump to the referral. So really helping them think about what can they do in their role, what are those conversations, what are those interventions, and then that's where you as faculty can really help them think about what might that look like in their specialty. So if they're a nurse midwifery, student, they'll care for patients with serious illness too. So how might this play out when you've got someone who's pregnant, and how does that factor into your symptom management? So that's where you can think about, again, tailoring things.
And it might not even be symptom management for that one. Like for nurse midwives and CRNAs, it might be about the communication part, right? Of asking people about them. Somebody asked about some of the population and social determinants of health. I mean, I think one of the things that I know has been really clear about all these modules is, if you think about population health with some of the diseases, that's one way of population health. But then also thinking about some of the populations who are not recognized that well. So, older adults are significantly mismanaged, people who are incarcerated, the LGBT community does not feel safe, certainly marginalized populations. So trying to think about how do we ask some questions for them, open-ended, not making assumptions, and really thinking about the cultural aspects, go through all of these things from pain, symptoms, communication to care at the end of life. And if we aren't asking what people's vision of health and wellness and death and dying are, or how much information they want to know, just as basic communication skills, wherever you are, then we won't be able to help some of that. So I think it's also helping people think about asking some of those pieces so that we don't create a plan that's not workable.
So there is a question that came through just to me, so it didn't pop up on everyone. That's fine. One of the questions is, are we still reusing Relias for our graduate program? Yes, our online curricula, the undergraduate and graduate, are still based through Relias, which is our learning management system. So for those of y'all who might not be using it, $29 per student, and that's for a 12-month access. And so that's where Andrew and I can kind of step in and help schools think about how might they integrate that into their program if they're trying to figure out that piece of it. And then the other part of that question is, do we have a different way for students to receive the modules for the ELNEC program? And so while this is focused today on ELNEC graduate, as I had a slide earlier, there are many different ELNEC curricula. So there are some schools that might be using some of the other ELNEC curricula. ELNEC, oh, Andrea, I might need your help to make sure I'm not saying this wrong, but critical care and pediatrics and geriatrics and core, I think. We have 4 of our programs that are also have an online version, which is a little costs more than the $29 because we've really tried to design these for the student learner. Some schools do use our other online programs. Those are still through Relias. And then there are some schools where their faculty will attend an ELNEC summit where they'll actually attend one of our ELNEC in-person 2-day courses to really learn core or APRN or whatever track that might be. And our ELNEC Train the Trainer courses are designed so that the attendee leaves with the resources for the module, so the slides and the resources and supplemental materials. So there's some schools that it works better for them to have a faculty trained who then uses those in the classroom. So it sort of just depends on your school, what makes the most sense. And that's again where we can be helpful, sort of offline, just thinking about if there's any barriers or challenges to thinking about how you might integrate whatever is the best resource with your students. So I hope that answered that question. If you have more follow-up, you're welcome to direct message me there as well. Pat asked, what is the length of time a student would spend in a given module? The nice thing is that the way our platforms are designed is that on the main page, when they actually try to, they click on the module to go in and open it, it actually tells the length of time. So in its current version, module 4 of symptom management for graduate is about a 1-hour course. So we expect for students to spend about an hour of time. And then one question we also kind of get, depending on what state you're in and what in the Board of Nursing that you work with, how do you define online? I know I'm in Texas where we're restricted in how much online content we can have. And so the way we view our ELNEC modules is that they're really sort of more pre-class preparation. It's not class time, it's not lecture material. This is really their preparation for class. It's like if we assign textbooks readings, but this is giving them a better resource, we feel, for palliative care preparation. So they do the module outside of class as a preparation, and then they come to class, and the in-class time for my face-to-face program is face-to-face application focused. But again, that might be more than you want to know at this moment, but we can really help to think about what are ways to make it work for your program, depending on any challenges you might be facing related to regulations or accreditation or things like that as well. And then Dana, I just wanted to follow up and see if you have any follow-ups or if we didn't fully answer your question about population health. But we do try to thread across our modules elements of culture, elements of ethics and legal considerations, considerations of financial stewardship that comes out, and thinking about equitable access and barriers that individuals might experience. We do try to integrate that, but rather than having a dedicated module, we really try to integrate that content as we're exploring these different concepts. Other questions? Or Connie, Pat, anything else that y'all want to share?
I think the one thing that was brought up is that the modules are continually evolving as evidence changes all of our practice.
If I may say something, I'll turn my camera on a minute so you can see me. I don't know if this is the right time to say this or ask it, but I teach the adult geri content in the FNP program where I am. And one of the modules has to do with end-of-life palliative care. And currently, embarrassingly so, it's pretty woefully inadequate at the moment. So what I'm looking for is the best way to add to what that module currently has, so that the students I'm teaching are not only aware of this, okay, but learn a little bit of something, but without totally overwhelming them, because we have an entire semester of information I have to give them. Does that make sense? Am I making sense?
Yeah, so a couple things that come to my mind, and then team members, please join me if you have thoughts as well. You mentioned this is your adult Gero curriculum, right? The program.
It's the FNP program, and I teach the course that is
Okay.
the adult Gero portion.
So one of the things, the way ELNEC graduate was designed was to try to be comprehensive, but not, but to some extent, because we're trying to cover a lot of different areas, we maybe don't provide as much depth as you need for a certain topic. We do have some schools that, for example, I mentioned geriatric, or ELNEC geriatric has an online version, and you can actually have buy the whole curricula of 8 modules, 6 or 8 modules, or just have students buy one. So there are some schools that might, for example, instead of having students, like they might have them do the ELNEC graduate end of life, but then also because they want them to have more of that geriatric component, they might have them do the final hours model from ELNEC geriatric. So that's a way. The other thought that came to my mind is if you have those thoughts of ways that things that you'd like to have added, we are going to be updating ELNEC graduate in the coming year or so. We're going to start that work. So we would love to hear feedback on what those topics might be to see if there's opportunities to integrate. But the nice thing with the graduate is that there are those other curricula that some schools choose to have students do a module from one of those other online curricula, or sometimes faculty just recognize that then that the ELNEC graduate lays a foundation, but then in the class, they want to make sure that they are augmenting that content with some specialty area considerations.
Thank you. That's very helpful. I appreciate it.
Marcia, yay.
Hi, thank you. I wanted to tell you how we use the graduate program. I don't know, I can't see if I'm, my picture, if my head's up or not or whatever, but
You look great.
We see
okay,
you.
good. Okay. We have the students do all the modules in the ELNEC program for the graduates. And then we also have like 4 virtual, this is online class mainly, but we do have 4 virtual sessions with the students. The first one, we cover the difference between palliative and hospice, a long topic discussion, of course. And then another one, we do have the hospice panel. We have an inpatient hospice in our at Rush, and so they come and speak to the students virtual, of course, and tell them about all the different team members and how they all participate, and they usually give a case study of how they participate in the care of patients in their place. And they talk also about the outpatient, how it is for home health care. And we have the students also listen to one that's like delivering bad news, and it's like a YouTube that it talks about. There's 2 sessions, one where the physician does not do too well, shall we say, in delivering the news, and then the second one is how well she's done, and how much better it is. And we have that open discussion then about, how it looked, how they feel. They always have questions about, well, I want to know how I should do it. They're afraid that they'll do something wrong. So we like for them to, and I wish we could do it a little bit easier, have them role play. But with 78 students in one class or whatever, it's a little difficult. Yes. So we try our best. And then we do have, like, for the virtual sessions, we have them do an exit exam, which shows that they were there, they participated, and they had to answer some, very simple questions that were covered throughout the class. Yeah, so I mean, that's kind of how we do it. And then, they get their grades, and they have to have the 80% or higher in order to get credit for their modules, so that they can get the certificate at the end. And the certificate has been a big positivity, shall we say, in the course, because they all want that certificate. So it helps them, they still have a long way to go, but they could also use a lot of the information that we provide during their regular, interactions with patients. So that's all I'll say.
Do you have them do all the modules before you do your virtual?
No.
Okay, so they're weaving them in. They're doing a couple, then you
Right,
live
right. So we try to
Mhm.
make it so that, they're doing certain ones. We may even kind of like switch them around, like maybe do, I don't know, module 7 before 8 or whatever, depending on, what we wanted to cover.
Nice. Thank you.
So
Yeah, thank
another
you.
question came through the chat about whether faculty have access to ELNEC modules. So wanted to I think that's a great question we haven't touched on yet. All faculty at School of Nursing are able to get free access to ELNEC undergraduate or ELNEC graduate. It's an email to elnec@coh.org. So it's any faculty member in a School of Nursing could get that free access. So I mean, in theory, if you wanted all your faculty to have it or all your faculty in a program, it's an email with to ELNEC saying, here's all the email addresses of our faculty that need access to it. So faculty get free access, and then the students, again, it's $29 per student.
And just to add to that, it doesn't, you can still access it even if you're not using it and you're considering using it, or you want to use pieces of it to augment what you're already doing. So that's not a requirement.
We've seen that with some schools that for buy-in purposes, maybe they see that they want to use it, but they have some faculty that are struggling to understand what that is. And any faculty member can get access to undergraduate or the graduate curriculum. Now the other online, that's a different story, but for ELNEC undergraduate and ELNEC graduate, faculty can get free access to that. And then again, some faculty, in terms of having access to ELNEC resources, again, going to the summit, to attending a train the trainer, that's another opportunity. That's different. But in terms of the modules we're focusing on today, yes, any faculty could get access. I want to, I don't know that we have time for breakout rooms, and that's okay because this has been a great discussion, but I do want to just share some additional resources that might be helpful as you consider symptom management education in your graduate program. So I'm going to share my screen again. So one of the things, and I know you can't see these very, very well, and that's okay because I'm going to show you where you can find them. But on our ELNEC page, our team of faculty experts in palliative care have created a few infographics that cover dyspnea, anxiety. There's a quick guide for symptom management that covers those common symptoms and sort of bullet points some of the main interventions or the main considerations you might want to integrate into your plan of care. There's one on meditation, meditation and mindfulness, and then also long haul COVID. So what I wanted to do is share where you can find these. So try this over here. So this is the ELNEC webpage. It's I just always type ELNEC into my Google search bar and it brings it right up. But from the main ELNEC page, which again, we are housed within the American Association of Colleges of Nursing. We've had a very long-term standing relationship with them since the inception of ELNEC. On this page, there's this tab here that's resources. And so if you view those resources, we have lots of other things, our ELNEC newsletter, which if you haven't joined a webinar before, you'll get added to our list and you'll be receiving our ELNEC communications. But here we have reference cards. This is where you can find the symptom management guide. And again, it's much longer than I showed on that. One of the things that some schools will do, where did I put my, is like, I have a printed out version that's laminated, that's folded, so I can just like tuck it in my pocket and take it with me to go. So there's that one. And then there's also one for pain management, even that's module 3 of our graduate curriculum. But then there's also these infographics. And so this is again where you could download infographics just as another resource for students as they're thinking about these. One idea that was presented in our webinar for symptom management on undergrads was maybe creating an assignment where students develop an infographic about symptom management, managing one of these symptoms for their population, or really from the lens of their for a graduate student of really how they're training for their APRN or whatever role they're preparing for. So that's how you can get, so you get to that from, again, the resources tab under ELNEC. But I also just want to show the faculty corner. This is a resource that we're really continuously building out to support schools of nursing with teaching palliative care, that sphere of hospice, palliative, supportive care. Maybe you've seen it, maybe you haven't. It is undergoing a facelift, so just so you know, in the coming weeks, it will be looking different, but the content will still be there. We have our webinars here. One thing I do want to point out is that we do have regional support. So we've identified faculty experts throughout the country who really have done some amazing work in palliative care education at undergraduate and graduate levels. So if you're trying to find someone closer to you, or maybe in your state, who really might understand some of the Board of Nursing considerations or what your state population needs, we encourage you to find out who your chair is. If we haven't found someone for your state, it's Andra and I who are there to support you. We want everyone to know that you've got someone who can help you with this. We also have this whole section here on teaching and evaluation resources. There's simulations, there's teaching exemplars. Andra and I have recently added a way, it's under teaching, but a way to access any of the instruments we've developed that evaluate learning outcomes of knowledge and perceived competence in a competence tool. So we do have a perceived competence related to the GCARE. So just letting y'all know that these resources are here. And we really encourage faculty who are doing these great teaching strategies or doing this work to share if they're comfortable doing so. There's a way for y'all to share these resources, because we do want to continuously build out the faculty corner as well. And then also I mentioned we've had lots of webinars. You can find all of our recorded webinars under the webinar tab of our faculty corner. And then here's, again, there's more information on how you can access it and that sort of thing. Well, I think that was it for my slides. Okay, so what we'll do is in the last few minutes, just if there's any questions or if anybody wants to share any of the strategies that they're using in their school, just as a way to highlight some of the great work that you're doing, we're happy to have those conversations, or if there's any more questions for Pat or Connie.
How many of you, if you could just like put in the chat, how many of you are here that are using the curriculum?
Just raise your hand too.
I wanted to, while you're doing that, I wanted to just circle back to make another plug for one of the things that's not kind of normalized, I guess, is sharing teaching strategies with other folks. You know, we sort of like, is this academic? What is it? What's the word, Megan? You know, when it's academic,
oh, well, people wanting to like protect their proprietary knowledge.
Yeah, there's a term for it.
Yeah, something like that. We share. That's our motto. Yeah.
In, you know, Dr. Farrell, who is behind all of this, is all about sharing what we have and not reinventing the wheel. And some people around the country are like doing really cool things, and we're trying to get folks to share that. And of course, we would give you credit, give you and your school credit for that, to share that with others. So if you have some really cool things that you're doing, please let us know and we'll put them on the website. And you can add it to, you know, sort of scholarship of teaching, that you've shared this out with other faculty, other schools.
This is really sort of a national dissemination outlet. I mean, we're putting it on our national website. So just letting people know that we encourage you to share that with us. And if you want to find out more about what that would look like, we've really let people think about how they want to. We have some of our resources, faculty have provided sort of a summary, and if you want to see the resource, contact them. Others put the whole thing out there, so there's lots of flexibility there. In the last few minutes, just a couple, I guess, housekeeping type things. One of the questions we typically get is, can we have access to the slides? Yes, absolutely. After this webinar today, Andrea will be sending out the slides from this, as well as a link to the recording. The recording and the slides will also, in the near future, go on our ELNEC Faculty Corner, so that if you have colleagues who maybe you think might benefit from this information or from any of the other webinars, they can access it from the Faculty Corner. And then again, our next webinar is going back to our ELNEC undergraduate or the new graduate curriculum, focusing on Module 5, which is loss, grief, bereavement, and we'll be joined by Dr. Susan Meskis for that one, as well as our graduate Module 5 final hours in December. And those dates and times are already posted on our Faculty Corner. You can register now. There was a question about accessing. Faculty can request access by themselves. This does not have to go through any sort of administrative approval. You can email elnec@coh.org directly and request access. The caveat to all of that is that it needs to be requested to a university email. So if you email ELNEC and request faculty access, you couldn't use your personal email of like a Yahoo or Gmail. We do want to see that it is a university affiliated email address, but it doesn't have to go through your administration. Especially, we try to reduce barriers to accessing this. Now, if you're not using it in your program and you do think this is a resource that after you've reviewed it, you do want to integrate, that you'll have to follow your own sort of governance structures in terms of curriculum committees and approval and that sort of thing. And also just know that ELNEC does has worked with Relias to find a way where now Relias can connect with your bookstores so that students can purchase access to the undergraduate or graduate curricula through their bookstores so that they are able to use their financial aid to purchase the curriculum. Well, with that, I want to thank Pat and Connie for joining us today. We always value the opportunity to hear their wisdom and expertise in this. And I want to thank y'all for joining us today. And hopefully we'll see you on a future webinar, and we'll give you 3 minutes back of your day. So maybe go grab some coffee, take a bio break, and have a great rest of your day.
Take care. Bye.
Bye, y'all.